I don't know what the barriers are.
Yeah.
You know.
Well, I think it's a commitment that all Jamaicans have to make. And you know, this Minister of Health wants to sort of re-energize the medical clinics around the island. You know, there are over 300 of them.
Yes.
If we can get them functioning properly with adequate equipment and staff and a doctor on call 24, it would take so much pressure off the regional hospitals.
Right. Definitely.
Because now everybody who wants any kind of medical care has to go to the regional hospital, and they just can't cope. And the problem is our medical centers, we don't have a doctor on call. They maybe come once a week for the day or half a day. And then the nurses don't have the equipment, they don't have the supplies to deal with just basic needs of the community. So this is why we're trying to raise funds, and we're not doing a good job there. So far we only have 2.5 million Jamaican. We need to raise 150 million to turn that Negril clinic into a first world clinic with equipment, doctors round the clock, nurses round the clock, for the community.
And the key is it's going to be a public hospital. It's not going to be a private hospital.
It's not for gain.
Right.
It's to serve the needs of the community.
Right.
And I mean, obviously, if a tourist get hurt, I mean, he can go there. Dr. Foster is putting up a clinic here as well, but that's going to be private.
Right.
You're going to have to pay for that. But it's a private thing. But so the minister, Dr. Tufton, says more public-private partnership, and we have adopted this clinic through the Chamber of Commerce.
Right.
And with your help and anybody who wants to come on board, you know, one Coca-Cola basket. We're not doing a good job in terms of reaching out, because $150 million is not a lot of money in the scheme of things. It's like $1 million US, a little over that. But if everybody gave $5 or $10, it would add up, and we would raise the money, you know. But he said that if we can raise half of the money,
They'll match it.
the government will match it.
Right.
And we're a long way off. All we have is $20,000 US in the bank.
Well, I can tell you that the JAHJAH Foundation is on board in this initiative.
Uh-huh.
We have to figure out, working with Ms. Bradley and yourself and other members of the Chamber of Commerce, to see how feasible it is and how we can play our
Well, you
part.
know, and I spoke to Diane Pollard, who is the chair, the CEO of the Issa Trust. She wants to help, but you know, you're dealing with government bureaucracy. We don't even have the clear lines of how to proceed from the Ministry of Health's point of view in terms of going forward. We need something in writing from them, not just a blessing of the minister.
Right.
So you have to deal with the bureaucracy, and that is the process we're going through. But in the meantime, we're pressing ahead with the collection drive to raise the funds. The thing is this, they did a plan. They did a plan for the upgrade of that hospital, of that clinic, and it was costed by people in the Ministry of Health, and that's where the figure of 150 million Jamaican came about, which I think is money well spent. You know, because if you have a healthy populace, you'll have a productive populace.
Absolutely.
And the problem with rural Jamaica is that the health care is inadequate. Every parish throughout this island you visit, inadequate health care is the biggest concern of the communities. You ask the people when you go by. Obviously jobs are important as well, but we need to really step up our healthcare system. So with your help, of course, we can do it.
Like I said, the foundation is on board with my supporters back in New York and New Jersey. I'm sure we'll get it done. And the key is we have to start with one health center and show them how it's done. And
exactly. This could be the prototype. This could be the catalyst.
It will be.
That will sort of set the standard for other parishes and other communities across the island. You know, when you think about it, I was surprised when I heard there were over 300. There were over 300 of these clinics. But most of them are in
rural areas.
Rural Jamaica, but they're they're on life support. Hi, my name is Issa, I'm a director of the Chamber of Commerce, and I want to congratulate JAHJAH for the JAHJAH Foundation for the great work they're doing in trying to bring first world healthcare to the Jamaican people. Badly needed, and I want to encourage other associations and other foundations around the world. Come on board. Let's do it. Let's do it. You know? And I think that with the commitment of communities around the world that care about people and the Jamaican people, that we can really bring Jamaica into the 21st century with a first world healthcare system for all the people.
Thank you.
Thank you very much.